Hi, my name is Dr. Nicole Connolly, and I'm a licensed clinical psychologist in Santa Clarita, California. I'm excited to talk today about a topic that is something that I get a lot of calls and a lot of questions about from parents, and that is, how do I know when my child's anxiety is at a point when I really need to see a professional and seek some sort of therapy or medication or some sort of treatment for this anxiety problem? I get a lot of calls to my practice. A lot of times when I go out and speak in the community, this is one of the most common questions that I get. And I wanted to share with you really my 3 criteria for considering whether or not this is a problem that really needs to be addressed professionally or whether to kind of let it ride out. Because if there's one thing we know about childhood anxiety, it's that a lot of it is really normal. Kids get anxious and worried about a lot of different things as they're growing up, and a lot of that anxiety and worry is just really kind of a normal phenomenon. You think about small infants and how anxious they get about strangers, people who are unfamiliar. They know and are used to their caregivers, but when someone new comes along, that can create a lot of anxiety. Most kids go through normal phases of separation anxiety where they get really anxious when they're left by mom, dad, or whoever takes care of them most often. And it's also normal for a lot of kids to have really intense fears and phobias. Things like being afraid of the dark, being afraid of spiders, worrying a lot about school. Sometimes those things are just kind of normal. But there are ways to tell when it's getting to a point when you really should be concerned and looking for some extra help. The first criteria I look at is, how long has this problem been going on? Usually when we're thinking about pretty normal routine anxieties, they pop up and they last for a little while and then kind of get better. You do your normal parenting thing, you help soothe your child and they respond, and the anxieties kind of go away naturally over time. When we're looking at anxiety that really is getting to a point where we would consider it an actual disorder that needs to be treated, we're looking at anxiety that's going on for months and months and not really responding to much that you're doing as a parent. We also want to look at how intense the fear is. That's the second thing we want to look at. How upset and distressed is your child getting? If your child is getting kind of worked up but is able to calm down and it doesn't seem too intense, then that might be a little more normal than if your child is getting really worked up and they're having a really, really hard time getting themselves calmed back down. That's a sign that maybe the anxiety is getting to a level that they need some sort of outside help to figure out how to get that back under control for them. And the third thing that I look for is how much this anxiety is interfering in their day-to-day life. And I think that this is the most important criteria, because anxiety that's kind of normal and transient may disrupt things temporarily, but kids who are experiencing so much anxiety that it is causing a lot of disruption to school, to their ability to focus and concentrate in school, anxiety that's causing a lot of problems at home, a lot of difficulty with doing the things that they normally like to do. It's taking up a lot of time. Everybody in the family's having to get involved. That starts to signal that there is a significant problem and that this anxiety may have gotten to a point where you really need some outside help to get it back under control. So if you are feeling like your child may need some extra help to get their anxiety back under control so they can get back out and do the things and be successful in the way that you'd like to see them be, then reach out, contact me if you're in my area. You can certainly email or call me and I'm happy to talk with you about that. Or you can go online and look for a therapist for your child. There are lots of great resources out there. Psychology Today has a great directory. The Anxiety and Depressive Disorder Association of America, ADAA, is another great resource. The Association for Behavioral and Cognitive Therapies, abct.org, is also another great place to look for a therapist online. Thanks. I hope this was helpful to you, and stay tuned for more in the future. Bye.